Senator Wright, you've got some questions in this area, have you?
Yes, just a couple if I can follow up, if that's okay. Thank you for that. Yes. Look, I'm interested similarly in the decision to take the funding from Partners in Recovery that was for these 13 and put it elsewhere, 53.8 million. And I'm interested in the commentary by the Public Health Association of Australia that asserted that this will increase the burden on families, communities in the acute healthcare sector. Now, I've heard over and over again throughout these estimate hearings about this is a budget decision, this is a budget decision, this is a budget decision. We chose to not fund this program. But there's a million budget decisions that could be made and only some that are made. And I'm always interested in understanding what predictions or what modelling or what assessment and evaluation there is that underlies the decision, because every decision has consequences. So it sort of follows up, I think, from what my colleagues there were saying. What review or analysis occurred to inform the decision to cut this program's funding? Was there any consultation with anyone in the mental health sector before the decision was made, or was it purely just choice of these dollars as opposed to other dollars?
Sorry, Senator Wright, I don't know if you were in the room. Mr Booth made some comments earlier, as have I.
I probably wasn't. I
yeah, so I know
that's
absolutely fine, and I accept that. But we're waiting till the final report from the Mental Health Commission review to actually inform the appropriateness of that program, and obviously right across the board of the mental health sector, before there's any more expenditure of funds in that particular area.
The trouble is, I mean, I've heard that too about many programs. The trouble is, in the meantime, the people who are going to be receiving services from that program are not receiving those services. So you would understand there are consequences of making that decision or that deferral, and I'm interested in what evaluation, what predictions, what consequences were considered before that decision was made.
Well, Senator, in terms of the decision in the budget context, I can't really comment, but I'm happy to take on notice insofar as I can get an answer to that question for you, not being privy to it.
So you don't know if there was any consultation with the mental health sector about the consequences of deferring that funding pending the outcome of the review with the National Mental Health Commission? Is that what you're saying? You don't know?
I wouldn't like to make an assumption, so I'll take that on notice.
Thank you for that. And also then, if you could also, because I presume you wouldn't know this too, what programs will fill the gaps that the cuts leave in the meantime until there's some subsequent decision either to roll those out and fund the program further or not?
That's certainly, Senator.
Thank you. Thank you, Chair.
Thank you, Senator Wright. Do we have any more questions in the area of Medicare locals?
I've exhausted my questions for Medicare.
Okay, then.
Perhaps if I could just ask one more then. I'll just generally...
I suppose.
Because that was mental health specific. It's just, and I don't know, again, this may have already been canvassed, asked, but will... The question I'm interested in, and it has been generally asked, is how will mental health concerns and community-based organisations be represented in primary health organisations? And will they be eligible to join PHO clinical councils and PHO community advisory councils?
In terms of the clinical aspects, as I described earlier, there are going to be clinical councils established. These clinical councils will be councils that are GP-led, and they will have the purpose of working through care pathways to ensure that the primary care sector and the secondary care sector are effectively linked up, and for particular issues such as mental health, there are effective care pathways put in place for clients to actually work through the system. So we would expect that, those, as I said before, those will be GP-led, and they will have a variety of clinicians on them. I can't go into a great deal of specifics at the moment, Senator. We're still working through the policy around that. And as we are, in terms of your question around membership, we are still working through the policy and the development around that.
So in terms of that policy development, what consultation is there then with the mental health sector generally? Obviously clinicians are important, but community-based organisations are absolutely crucial in this area as well.
That's correct. As I said previously, Professor Horvath did a significant amount of work in terms of talking to a range of different organisations, and he also did a submissions process where people, you know, provided submissions to him, and I do know mental health issues were raised within that, and we are still working through in terms of consultation and work that we are doing at the moment, and we're still in the midst of doing that.
All right, thank you for that. Thanks, Chair.